Achoo. Allergies getting you down? Here's some ideas. Guys, allergies, one of the most common things. Everybody experiences allergies just about. Usually they're seasonal, and usually it's some foreign, some object, some pollen, something that your body doesn't really like or get along with, and it causes an allergic reaction. We call these little substances floating around in the sky or in the air antigens. And when that antigen hits your nasal mucosa, it processes it and says, holy cow, we don't like this thing. Let's send a whole bunch of histamine to that area. You have these little mast cells and they explode and they release lots of histamine. And that histamine then causes tons of runny nose, tons of symptoms, and tries to get that foreign substance out of there. The mainstay of therapy, you don't have to have a doctor to do. There's a couple of over-the-counter things that work really, really great for this. One of them is Flonase or Nasacort. So both of these are nasal steroids and they just calm the nose down. So where this antigen is hitting and it's having a very strong allergic reaction to it, the nasal steroids tell your body to just calm down about it and not get so stressed out. So very effective, works really great. The other one is antihistamine. Everybody knows these. There's 3 non-drowsy ones. There's Claritin, Loratadine or Zyrtec, Cetirizine, and Allegra. And these 3 medicines are really great as antihistamines. They're not in the Benadryl or Dramamine category. Those are the sedating ones that make you super sleepy. So they should have a lot less sedation with them. I still take them at night myself, but yeah. So just one of those once a day, super easy. And then the Flonase or Nasacort as a nasal steroid. And that solves probably 70–80% of people's allergy problems. And you just have to be consistent. Some people are just once a weekers on some of those, and of course they don't work if you just do them once a week. So try and do them every single day during allergy season, and they should calm things down really nicely. I probably do like 3 times a week, and my allergies are cleared up nicely. So whatever it takes to get you therapeutic results is great. If that doesn't work, however, there's a couple other options for you. So there's some prescription things that we can do, some mast cell stabilizers and things like that we can prescribe as doctors, and those work really well as well. Secondly, what about like curing this? Is there a way to cure allergies? Well, yes, there is actually. Immunotherapy is very, very common, and so you can do some immunotherapy. Work with an allergist and an allergy specialist. Those guys will figure out which substance you are allergic to. Your family doctor can do this as well. Once you figured out I'm allergic to these 3 things that hit my nasal turbinates and cause this massive allergic reaction, then you can develop what's called these little serums that have a very small amount of that thing and inject them in your skin once a week, and then eventually get to where you inject them once every couple weeks and eventually once every few months, and then maybe even once just a few times a year. That takes a long time. It's a really expensive and really tedious task. And the injection is subcutaneous, so it's just a very, very small injection under the skin. It's not into your muscle or into the fat or anything like that. It's just barely under your skin. Usually those shots are administered at a doctor's office, and we watch them for a little while, make sure they don't have a massive reaction. And then they slowly increase the concentration of that substance until your body mounts less of an immune response to it, and that's called immunotherapy. Pretty effective. And so those are basically your treatment options for allergies. If allergies are giving you trouble, hopefully this video was helpful. Don't forget to like and subscribe. I'm Dr. John Sanders, founder of Voyage Direct Primary Care. I'd love to have you guys check out our website at voyagedpc.com. Learn more about our subscription family medicine model. It's beautiful care.